This PowerPoint is going to cover strokes, Bell's palsy, and cerebral edema. What is a stroke? It is an acute onset of a neurological deficit resulting from hemorrhagic or obstructive vascular lesions, and it can lead to a cerebral infarction. What is an infarction? It is a sudden insufficiency of blood supply that produces a microscopic area of necrosis. Brain tissue dies due to lack of oxygen. Typically, this is caused by an emboli or a thrombi, or high blood pressure, or a vascular torsion. The extent of tissue damage is determined by a couple of factors. The duration of lack of oxygen, meaning how long was the blood flow cut off to the distal tissue, or the adequacy of collateral blood flow. The circle of Willis is actually the major source of collateral blood flow in the brain. So if a small vessel in the brain was occluded so that the tissue beyond it, distal to the occlusion, was not getting enough oxygen, if there was enough blood supply to that tissue from a separate source coming from the circle of Willis, that tissue then may survive. What causes a stroke? A stroke occurs when something blocks or diminishes blood supply to all or part of the brain. There's two types of strokes. You have ischemic stroke, which also has two subdivisions, a global ischemia or a focal ischemia, and then you have hemorrhagic strokes. Global ischemia occurs when there is a general reduction of blood flow to the entire brain. That's a key term. Global is entire brain. This can be caused by low oxygen levels in circulating blood in the brain. That could be due to, say, severe anemia or leukemia, anything that's going to impair oxygen carrying capacity of the red blood cells. It also can be caused by decreased perfusion, such as severe hypotension, which typically can occur suddenly as a result of shock, loss of a lot of body fluid, say from a major part of the body receiving a burn and their extracellular fluid evaporates. And then you can have complete lack of blood flow during a cardiac arrest where the heart suddenly stops and there's no blood getting pumped anywhere. Global ischemia can lead to a situation called brain dead. In mild cases, if oxygen is restored within less than 6 minutes, there's no irreversible brain damage. That means the brain cells can recover. However, if the oxygen supply is cut off for longer than 6 minutes, the individual is then considered brain dead due to the significant amount of tissue damage, and they will flatline on an electroencephalogram. What happens if blood or oxygen is restored right at the 6-minute mark? I have no idea. So I will not ask you that, but just keep in mind that 6 minutes is the magic number. Less than 6 minutes, their brain tissue can survive. More than 6 minutes without oxygen, it cannot. Liquefaction. This is when brain-dead individuals undergo autolytic process of brain tissue that is caused by long-term use of a mechanical ventilation. The brain tissue, the cells, the parenchyma, all of that just turns to liquid. It's also known as respirator brain. Result of global ischemia. The most common cause is dangerously low blood pressure for global ischemia. It's also known as a watershed infarct. The greatest risk is the border zone between the anterior and middle cerebral artery. It affects the most distal regions of the blood supply to the brain or the spinal cord when you have global ischemia that causes these border zone infarcts. Focal ischemia versus hemorrhagic stroke. Focal ischemic strokes are caused by a blockage of a brain vessel, some kind of substance blocks it. It can be a blood clot, fatty tissue, bone, air, anything that's going to occlude blood flow. Hemorrhagic strokes are caused by a rupture of the brain vessel that can be caused either from an aneurysm rupturing or trauma to the blood vessel. Focal cerebral ischemic stroke. This is a decrease or completely occluded blood flow to a localized area of the brain. Sustained ischemia will lead to infarction, that 6-minute rule. And then infarction is going to lead to cell death due to hypoxia, lack of oxygen. There's two types of structures, if you will, or substances, names types of ischemic strokes, and that is embolism and thrombotic occlusions. Thrombi versus emboli, the causes of a focal ischemic stroke. Thrombi is material associated with atherosclerosis, such as plaque. The most common vessels affected by thrombi is the carotid bifurcation, or the origin of the middle cerebral artery, or either end of the basilar artery. The emboli is material or air that travels in blood. It occludes a blood vessel distant from its origin. The most common are thromboemboli, material that attach from plaque then travel. Example, plaque develops in the carotid artery and a piece breaks off, travels to the brain, and lodges in the middle cerebral artery. Embolic ischemic stroke, caused by traveling debris that occludes a vessel. I mentioned before it can be a blood clot, fatty tissue, bone fragments, or even air. If it's fatty tissue, it's also known as a shower embolism. Embolic ischemic strokes are the most common cause of stroke. About 87% of all strokes are due to embolic ischemic strokes. And the most common vessel affected is the middle cerebral artery in the brain. It can occur with or without any warning signs. Some of the causes are heart disease, post-heart surgery, post-long bone fracture, and about 15% will occur in people with atrial fibrillation. The most dangerous part of this is, as I said, you don't know if you have a clot or debris that is floating through your circulatory system that could cause the stroke. However, if you have any of the conditions that I mentioned, then you will be on alert for this type of debris getting stuck in your blood vessels. Thrombotic ischemic strokes are when a blood clot develops in a blood vessel in the brain. What happens is, especially with chronic high blood pressure, the endothelial lining of the blood vessels are tender and they'll tear. And once they tear, the blood vessel itself is going to try to heal that. So what happens is the tear will form a blood clot, and then if it's repetitively torn, it'll have fatty debris lay on top of that and develop plaque, and eventually it occludes the lumen, making it smaller and smaller so less amount of blood can get through. This type of stroke, thrombotic strokes, do not travel. The occlusion occurs at the site of the vessel injury. As I mentioned, it increases with high blood pressure, leading to atherosclerosis. Other factors that can cause an increased risk is obesity, smoking, and oral contraceptives. This type of stroke may be preceded by little mini strokes called transient ischemic attacks. Transient ischemic attacks, as I mentioned, are mini strokes. They cause a sudden focal loss of neurological function with complete recovery within 24 hours, and these can be asymptomatic. However, if they happen frequently enough, the person might start to have some kind of a small or catch on to a little bit of symptoms, saying like, I feel a little dizzy or I don't feel quite right for about 10 minutes, and then it goes away. And if they know they have arterial sclerosis, then they should be able to pick up on that this is a transient ischemic attack. They are warning signs for a potentially larger ischemic injury to the brain. and they typically are caused by inadequate perfusion of the carotid or vertebral or basilar arteries. Lacunar infarct. We touched on these when we talked about hemibolismus at the beginning of the quarter. These types of infarcts can also be silent or cause severe neurological impairment, or the hemibolismus that we covered earlier. This is caused by hypertension, and this hypertension leads to arteriosclerosis of the teeny tiny deep penetrating arterioles that supply the basal ganglia. These arterial lesions lead to occlusions, and those occlusions lead to small cavity or cavity infarcts in the basal ganglia. These little infarcts are called lacunae, and that's how it gets its name, lacunar infarcts. The lacunae will show tissue loss and gliosis on an MRI or a CAT scan. Hemorrhagic strokes is when there's bleeding of a blood vessel within the brain that's caused either by trauma or from a ruptured aneurysm. The most common cause of hemorrhagic stroke is a ruptured aneurysm due to high blood pressure. Stroke signs and symptoms. If a person has a sudden onset of weakness, numbness, or paralysis in the face, arm, or leg, or slurred or garbled speech, or difficulty understanding others, a little bit of acute onset of cognitive disorder, like they can't remember where they are or the name for a few moments, or even blindness in one or both eyes or double vision, accompanied by dizziness or loss of balance, and a severe headache with no known cause, they could be having a stroke. And that talked about in the summary, the acronym is FAST, FAST for face drooping, A for arm weakness, S for speech difficulty or slurred, and T for time to call 911. Stroke etiology. Stroke is the 5th most common cause of death in most developing countries today, and the most common cause of neurological disability. I had to change these findings this quarter, because the CDC updated it. Prior to this, it was the 3rd most common cause of death, but now it's the 5th most common cause. But 1 out of 20 deaths in the U.S. are due to stroke. And we'll talk in a moment what has helped to reduce this rating from 3rd to 5th most common cause. Is because of improved emergency treatment for stroke. Years ago, they just didn't do anything except try to make the person comfortable. But now they have learned that if they can restore the blood flow as quickly as possible, first they have to identify whether it's an ischemic stroke or hemorrhagic stroke, because the treatment is pretty much opposite. If it's an ischemic stroke, their goal is to restore the blood flow by reducing the clots. They can administer aspirin, which will thin the blood, but specifically tissue plasminogen activator is a very strong medication that will bust open a blood clot that's occluding a vessel in the brain and restore blood flow rather quickly. And this can significantly minimize any of the permanent necrosis or damage that was caused as a result of reduced blood flow and thereby reduced oxygen to the distal tissues. If it's a hemorrhagic stroke, the main thing they need to do is stop the bleeding. Well, if you have good clotting factors, your own body is going to be able to clot that wound and stop the bleeding rather quickly. So what they need to do is reduce intracranial pressure. And they do that first with, they want to find out if you're on any medications that have blood thinners like Coumadin. And if you are, they're going to administer medication to counteract that. But they need to reduce your blood pressure to reduce the intracranial pressure. And also they will administer medication to reduce vasospasm or seizures, just to make your brain have the lowest pressure inside to allow that rupture to naturally clot from your own clotting factors, and then heal that vessel and restore blood flow. Now we're moving on to Bell's palsy. Bell's palsy is unexplained paralysis or weakness of facial muscles. It's not caused by a stroke, but it can look like a stroke because it can come on suddenly. Often, a person will just feel maybe a little tingling in their face before they went to bed and wake up and have total paralysis on one side of their face. It specifically affects the facial nerve or cranial nerve 7. It is typically unilateral, but it can be bilateral, but that's very rare. What's happening is with Bell's palsy, there's swelling, inflammation, and or compression of cranial nerve 7, the facial nerve. And this compression is affecting its motor ability to maintain muscle tone. So the person looks like they've had a stroke. Here's an example or a photo of a woman who has active Bell's palsy, where she's smiling on one side and the other side there's no response at all. The mouth is drooping, the eye is wide, and it doesn't show here very well, but her lacrimal glands might be excessively tearing as well. Bell's palsy is considered self-limiting, but if you watch the videos that I have posted in this folder for these conditions, you'll see that there's an example of one woman who's had Bell's palsy for 5 years. And this video, I like it because it talks about her being under chiropractic care and how for the first time in 5 years she's able to smile better and can see better, and she's getting great results from chiropractic care. Chiropractic treatment is amazing at treating or helping a person recover from Bell's palsy very quickly. It says here on the slide that it is the most common cause of acute unilateral facial paralysis and typically self-limiting within 2 weeks. Well, that's what the textbook says. But even if it is self-limiting for 2 weeks, who wants to go around for 2 weeks with, their face sagging on one side when a simple upper cervical chiropractic adjustment can make that go away almost immediately. And it says here, some cases can take longer and many do have repeat episodes. I've had many patients that unfortunately suffered with Bell's palsy, but they had my emergency contact information, and I had explained to them that as soon as they notice they have this, to give me a call, even if it's on the weekend or the evening. I give them adjustment. And it is amazing how quickly the individuals respond to chiropractic treatment with Bell's palsy. Bell's palsy etiology. The cause is unknown. It's considered idiopathic. It may be linked to a virus that inflames the geniculate ganglion. It affects males and females equally, and it can affect someone at any age. High-risk individuals are pregnant women, people with diabetes, or those with influenza or upper respiratory infections, or a history of mononucleosis, Epstein-Barr, herpes simplex 1, or meningitis. There is some links with viral infections. The incidence is 20 cases per 100,000 worldwide per year, which is not a whole lot, actually. But I think you'll find more of these, a higher percentage in your office, because chiropractic adjustments work very well in reducing the symptoms and helping an individual recover very, very quickly. I hope you take a look at that video I have about Bell's palsy in the folder. Some of the signs and symptoms, the person's not going to be able to wrinkle their eyebrow. They'll have a drooping eyelid and may have inability to close their eye or fully open their eye. They can't puff out their cheeks. They don't have any muscle tone. They'll have a drooping mouth, inability to smile. They may drool out of the corner of their mouth, and they may have abnormal tearing in their eyes. Bell's palsy's diagnosis. Well, with every kind of diagnosis, the best way is to get a good patient history. And then the clinical presentations, they presenting with a drooping face. So you would do a complete neurological exam and confirm that it's only facial nerve involvement. And you would want to rule out stroke. Well, that's easy enough. You just ask them their name, if they know where they're located, and if they don't have paralysis anywhere else. you need to rule out a vertebral dissection. And that's the only way you really could do that would be with a George's test and, with an MRI. But in your office, a George's test would be the most specific. So check for nystagmus. And, a tumor can cause drooping of the face, infection, like I mentioned before, herpes simplex 1, even Lyme disease, meningitis, Epstein-Barr, herpes zoster. So there's a variety of things that could be in their history that could cause the Bell's palsy. There really isn't any other medical treatment for the Bell's palsy. I have a picture here of Dr. Gonstead giving a specific upper cervical adjustment because I believe that is the best treatment for this condition. If medical doctors suspect that it's being caused by a virus, they'll prescribe acyclovir, which doesn't kill the virus, but it does prevent the virus from replicating. So what is the prognosis of Bell's palsy? It depends on the extent of the nerve damage. The more damage the nerve experiences, the longer it's going to take to recover. For example, when we covered neuralgia and axon mesis in neuromuscular fizz, the greater the damage, the longer it takes to recover. But they can have pretty much full recovery. But some individuals, about 10% of them, will develop some permanent mild weakness, and some develop a condition that's called gustolacrimation, also known as crocodile tears, where their eye is constantly weeping and they can't make it stop. Individuals who had Bell's palsy often will have reoccurrence, and typically it reoccurs within 10 years, but that is just, again, a typical number, and it is really going to vary between individuals. Now I'm going to move on to vertebral artery dissection, but before I do that, I just want to briefly cover the anatomy of a cervical artery, which really is the same as any other artery in the body. It has 3 layers. It has a tunica intima, which is the endothelial tissue that surrounds the lumen. Then you have a tunica media, which is the thickest layer, and that is muscle. It's made out of smooth muscle. And then you have the tunica externa, which is made out of connective tissue and some elastic fibers. Then that surrounds the outermost portion of the vessel. Vertebral artery dissection starts with an endothelial tear. Blood will leak from that tear, and it'll get behind it and separate the layers that we're talking about, specifically between the muscular layer and the endothelial layer. And sometimes this pooled blood will push against the muscular layer and against the connective tissue layer, causing an aneurysm. And an aneurysm is just a bulging or a weakness in the vessel and makes that vessel predisposed to rupture. How does dissection cause a stroke, or specifically dissection of vertebral artery? Well, there's 2 ways. One is where the endothelial tear forms a blood clot, and that clot decreases the lumen size, which limits blood flow, leading to hypoxic conditions, causing a stroke. This will occur at the location of the tear, or a piece of the clot can break off and travel, such as a thromboemboli, and cause an occlusion elsewhere in the brain. Then the other one is sort of what I alluded to on the previous slide, where you have a tear in the endothelial layer, and that tear will cause blood to pool, causing an aneurysm, and then subsequent trauma ruptures the aneurysm, leading to hypoxia and a stroke. Spontaneous vertebral artery dissection can be caused from other types of conditions, such as connective tissue disorders, Marfan syndrome, and Ehlers-Danlos syndrome, or it can be caused by arteriosclerosis or atherosclerosis. Also, high-risk individuals who have chronic high blood pressure or smoke or cardiovascular disease can develop a spontaneous vertebral artery dissection. Traumatic vertebral artery dissection can be caused by an auto crash, a whiplash injury such as hyperextension hyperflexion injury, or a hyperextension sports injury. Weightlifting can lead to this, and invasive diagnostic procedures. The angiogram that you see on this slide, the exam to see whether or not there is a vertebral artery dissection can actually cause a vertebral artery dissection. But the one thing that the media loves to focus in on is extreme hypertension with rotary or rotation manipulation performed. And the media likes to blame it all on chiropractors, but if you look at the research, most of them are being performed by lay people. I have a video in the folder here in this module where it shows a barber shop in India where all the barbers give their customers an amazingly strong rotational cervical manipulation with their haircut. Vertebral artery dissection symptoms. These symptoms can develop days or hours after the rupture. So that's one reason why I'm very skeptical about it always being blamed on chiropractors, because my theory is that vertebral artery was either already damaged before they had the subluxation or just about to rupture before so that the adjustment was really negligible in causing the dissection. But in any case, it rarely ruptures suddenly, because that vertebral artery is really pretty well protected between the bony foramens or the transverse foramens. But the general symptoms are headache, neck and face pain, double vision, droopy eyelids, pulsating or a pulse-style whooshing sound in one ear. And I have on the slide here red flag symptom. If your patient tells you they are hearing a whooshing sound in one ear, do not adjust them. Send them immediately to the ED for diagnostic imaging to rule out a vertebral dissection. And of course, weakness on one side of the face, you'd have to rule out Bell's palsy. You'd have to make sure that it wasn't a facial problems with the facial nerve that's causing it. But you see a lot of these symptoms. These are going to be typical symptoms that bring somebody into a chiropractor for seeking treatment. You just have to be careful in your practice. You need to keep good notes and be diligent and specific in your treatment. And don't worry about it. You're going to do your best. And I really don't believe that chiropractors really are the main facilitators of this type of dissection. Cerebral edema. The types we're going to cover is cytotoxic edema, that's caused by a stroke. Vasogenic edema, also caused by a stroke. Osmotic edema, which can be caused by overhydration, drinking too much water. Yes, you can drink too much water, or kidney damage. And interstitial edema, caused by high blood pressure or high intravascular pressure. Cytotoxic edema occurs immediately after a stroke. It's a result of a sudden decrease in oxygen, which is going to lead to a sudden decrease in ATP. When you have a stroke, ATP has to be produced via anaerobic metabolism. And the demands of neurons and glia cells is so high, the energy demand is so high, that the anaerobic metabolism just cannot produce enough to keep up with the demand. This leads to the sodium-potassium pump on the neuron cell membranes to stop working. And if they stop working, intracellular sodium is going to build up, because you know the sodium-potassium pump pumps 3 sodium out and 2 potassium in. So without that pump, that sodium is going to build up. Well, if you have sodium build up, then you're going to have a higher concentration of solutes within the neuron cells. If you have a high concentration of solutes, water in the extracellular fluid near that neuron is going to escape or leak out of the blood vessel and go towards or go inside the neighboring neuron. it's going to be drawn across via osmosis. This will cause that neuron to swell. Eventually, it can lead to that neuron rupturing, death by rupture. The neuron can be saved if oxygen levels rise quickly enough, say within that 6-minute mark, to allow ATP production via aerobic, either the electron transport train or aerobic metabolism. And then this swelling will reduce because the sodium potassium pump will get all that excess sodium out and the water regulation will occur. Osmotic edema is caused by hyponatremia or overhydration. You drank way too much water in the time frame that your kidneys could not eliminate it. Hyponatremia is an imbalance of sodium between the fluid inside brain vessels, which is extracellular fluid, and the intracellular fluid of brain cells. This happens anywhere in the body, but we're specifically talking about brain tissue right now. So the higher concentration of sodium in the intracellular fluid of brain cells, so the high concentration of sodium that's in the brain cells is going to draw the water out of the blood vessels into the brain cell until equilibrium has been achieved. It's very similar to cytotoxic edema. Now, the reason it's higher concentration is because you drank so much water, there's now an imbalance. So let's say before somebody decided to drink 2 gallons of water within 10 minutes, their sodium concentration inside their brain cells was normal. But then they put so much water in so quickly that it diluted their extracellular fluid so much that it is going to leave the blood vessel and be drawn into the brain tissue. When water is drawn across a semi-permeable membrane by the concentration of solids, this is called osmotic edema or osmosis. Interstitial edema is caused by abnormally high intravascular pressure, such as caused by high blood pressure or high atmospheric pressure. This increased pressure is going to push too much fluid through the choroid plexuses in the ventricles, which then pushes too much cerebral spinal fluid across the epidermal lining of the ventricles into the brain tissue. Hydrocephalus is a result of an accumulation of cerebral spinal fluid within the ventricles. This is caused by impaired cerebral spinal fluid flow and reabsorption. In the adults, ventricles will enlarge if the CSF cannot drain. Brain tissue is going to be damaged by compression. However, in an infant, the head will enlarge in an infant if the hydrocephalus or the blockage of CSF occurs before the sutures have fused. This, both in the child and in the adult, for survival, they're going to have to have a shunt put in that will go from their brain into the abdomen to drain the CSF fluid, and that shunt is typically left there unless the blockage can be repaired.